the landscape today is just completely different from the disease area that I joined in 2008. So I started my career in amyloidosis in 2008, and conversations with patients and their families in clinic were, there were two types of conversation. And David, you testified to this. It was either your echocardiogram is exactly the same as it was a year ago, and we'll see you in another year, or your echocardiograms got worse, and perhaps it's time to start, getting your affairs in order. So it was really, the options for patients and their families were just so limited, and there was so little that as healthcare professionals we could offer. And now it's, as Nikki and David have both highlighted, and the presentation from Prof. Fontana earlier, it's a completely different space. The conversations are so much more positive. There are treatments already available. There are more innovative treatments in development, and most importantly, people have hope. Patients have hope. People are getting diagnosed earlier. We're seeing that shift already, that cardiac amyloidosis being diagnosed much earlier in the disease course, and then having treatment. And so, that's fantastic, but there are still lots of unmet needs. And in terms of diagnosis, there are still issues, because we're still, even today, describing, for example, wild type ATTR amyloidosis as a disease of elderly white men. And yes, historically it has been a disease of elderly white men, but there's no end of data, presentations, publications, which actually challenge that. For example, people are being diagnosed now in their 50s, thanks to scintigraphy and non-invasive diagnostic techniques. We know that women also get wild-type ATTR amyloidosis, but they're not being diagnosed because our echocardiogram criteria are outdated and don't factor in body surface area. For the first time, we had a presentation on recommendations for holistic care of ATTR amyloidosis patients. So that was the first time that there were recommendations that were outside of the traditionally medical sphere. So looking at the broader needs of the patient population. And that was presented by one of the ACNAP members as well. And so those recommendations, they do include the more medical aspects. So they include early diagnosis and access to treatment. They include recommendations for disease monitoring and coordinated care, which is very important. But they also look at maintaining quality of life, physical and mental health. So there are recommendations for example, physiotherapy, occupational therapy, psychological support, all of these other aspects of care. It's really great to see that the community is now starting to look beyond the organ of the heart and look at what else patients and their families need. And actually last year at the Heart Cafe, you and David were there, I think, as well. And Prof. Fontana spoke really quite openly about her experience as a cardiologist. And she said that as a cardiologist, when she was talking to patients, she assumed that they were interested in what she was interested in, which was the echocardiogram result or the MRI result. And, and her learning curve as a physician was that, was to listen to patients and actually ask them what's important to them. And she was really surprised to find out that what they were concerned about was their mobility, so their ability to continue to walk and be independent. What was holding them back was bowel dysfunction, pain from their musculoskeletal effects of the condition. So, it is going back to your earlier question about how sometimes doctors and patients see the condition differently. We are now in this, in the sphere where physicians are recognizing that, patients value different things to promote their quality of life. It's really about that patient-centric care. So, not looking at labels or diagnoses, but rather at the person in front of you and working with them to arrive at the best, not just the best medicinal treatment, but also the best care overall, broad care package that person needs to help them live well with amyloidosis.